Component 1 comes the main items. 1 ventilator, 1 ventilator tube, 1 full face mask, 1 portable bag, 1 adapter and 1 power cord, 2 filter cotton, 1 ozone circulation connector, 1 use disc, 1 user manual. Step 2. Turn on the power. First, connect the power cord to the adapter. Plug the adapter into the power info behind the diverse and plug the power line on the socket. Enter the main interface when the scary light is on. Step 3. Humidify operations. First, press down the ejector button and then lift up the flap of the humidity. Grasp the outside of the content surface of the water tank and steadily push out the water tank. Fill the water tank with distilled water or purified water to the dot line on the middle. Don't expect the maximum water level. And then push the water tank into the humidifier smoothly and put down the flap to cover it. And then turn on the humidifier. Move and push the wall button into the seat, parameter, and the humidifier. And then select the appropriate grade according to the ambient temperature. Step 4. Insert and wear the mask. First, lay the headband on the desktop to form an inverted triangle. Second, put the upper headband into the two ends of the forehead part of the mask. And fasten the buckle on the lower side. Third, pop the nose mask on the nose with one hand and cover the headband from the top of the head with the other hand. Fourth, fasten the buckle on the other side of the button. 5. Both stress the left and right side and adjust the appropriate tightness. Can insert one finger. Step 5. Connect the pipe. First, connect the end of the tube to the air outlet on the upper cover of the humidifier. Second, connect the other end of the tube to the elbow of the mask. Step 6. Switch treatment on or off. First, on. Turn the wheel button to the treatment. Press the knob, and the ventilator starts to supply air. Second, off. Turn on the screen, press and hold the knob for 3 seconds. Enter the standby interface and switch off the treatment. The first function is treatment. The cursor stays in the treatment menu. Press the knob. The diver starts to supply air, and the parameters appear on the screen, indicating that the diver starts the treatment. The treatment interface displays real-time parameter values, such as treatment mood, real-time pressure, treatment time, leakage, tidal value, respiratory rate, and ejector. It is recommended to observe the leakage during use. If more than 60, it will affect the comfortability and effectiveness. If you want to stop the treatment, please press and hold the hold button 3 seconds to enter the stable interface. The second function is preheat. The preheating function is to heat the machine in advance, which can be turned on before treatment, so as to avoid that the gas blow out by the user when he just uses it. It's too dry and cold to be uncomfortable. The third function is sit. The mode of use can be selected. The general modes of respiratory treatment include CPAP, continuous passive pressure ventilation modes, self modes, S&T, self and time modes, the PC, pressure control modes, and VAT, volume assure technology modes. The most common used mode is S&T mode. Different modes have different corresponding modes. Please refer to the modes of this diverse detail. The next one is positive pressure of IPAP, inspiratory, and the positive pressure of EPAP, expiratory. These two parameters are used to set the pressure. The adjustment method is following step. Select the pressure, press down the wall button, and rotate left and right to set the pressure. These two pressure must follow the doctor's advice. Please don't adjust at will. The next is BPM, respiratory rate. This is a backup support for respiratory rate. Now, let's set BPM to 14. If the actual respiratory rate of the patient during use is higher than 14 times per minute, the device will start automatic breathing modes for air supply. If the patient's respiratory rate is less than 14 times per minute, the device starts the T mode. When setting BPM separately, we can subtract 3 from the number of times the patient's breathing frequency is at rest. In fact, it is more reasonable to set 12 to 14 correctly. The next is the ratio of section of expiratory. The general setting is 1 to 1.5. The next is the pressure release time, which means the time from the end of positive expiratory pressure to positive inspiratory pressure is faster or slow. The smaller the gear is, the faster the race time is. The next one is the parameter menu. Climbing the time and starting pressure of climbing. Set the starting pressure of climb to the less than the EPAP. The climbing time indicates the time took for the starting pressure of climbing to raise evenly to IPAP, but it is generally recommended in S or T modes. Turning off the climbing time is turn off the climb function. The next one is the parameter menu. Ramp time and starting pressure of ramp. Set the starting pressure of ramp to be less than EPAP. The ramp time indicates the time took for the starting pressure of ramp to raise evenly to IPAP, but it is generally recommended to in S and T modes. Turning off the ramp time is turn off the ramp function. The humidifier can adjust the temperature and the humidity of the gas. The higher the grain is, the higher temperature and the humidity. It can also be turned off. The next one is auto on. If it is selected on, it means that the inhale and the exhale can trigger the automatic air supply of the diverse within 2 circles after the patient wears the mask. And if choose the automatic off, turn on, that means that if the patients take off the mask and put it aside, the diverse will stop automatically the air supply 2 minutes later and enter the standby interface. The next is apnea and low ventilation alert. These two are physiologic elements which can be turned on or off according to clinical needs. The next is the time menu, which is used to set the current time. The fourth function is the system. This menu is the export menu, which is used to export the patient's data. At this time, a U-disk is needed. Insert the U-disk into the data import interface at the back of the diverse. And then press the O button. After the export is successful, unplug the U-disk. The clean function, the most highlight of the separate device is the built-in ozone generator, which can automatically clean and disinfect itself, so that it can effectively prevent the bacterial infection. The simple clean operation following steps. Press and down the bottom board of filter spawn place at the back of the diverse. Take it out and put it aside. And then put the ozone circulation joint in. Then pull off the voluntary tube into the ozone circulation joint. Return to the operation interface of the diverse and click clean. Click yes to turn on the diverse for automatic clean on power supply. After completion, air blow for other 10 minutes.